I'd just like to ask you some questions, actually, because I mean, this is great, and I think at the end of the day, you can come over. I can come over here and do a workshop like this, and you never know really what has transpired from it. But to hear stories like this is really, really exciting. Is it, you know, the most exciting thing is for the people who you've helped. That's the key, I reckon. So that's great. But I'd like to ask you guys a couple of questions. What made you decide to go and do this?
I think from my perspective was kind of out of frustration of kind of using traditional approaches to physiotherapy and having small effects. So when we came on the workshop, we thought, these guys change. And we were hearing about the research that you'd conducted. So we thought, well, let's see if it works. Let's go and do it and see what happens.
So how did you find it? How easy did you find it translating what we did here into, you know, what you do day to day with your patients? Was that a hard thing to do?
I think from my perspective, basically when I started as a physio, I was probably someone that lacked confidence, and in terms of the sort of processes that I was taught and sort of the belief systems regarding certain things like core stability, SIJ and that sort of stuff, it confused me and really gave me my confidence. So when I started working with Chris, he introduced me to this process of sort of assessing and treating patients, and I saw that these patients were getting better a lot quicker, and they seemed very satisfied. So I said to him that I'd love to kind of find out a little bit more. So I started reading up a little bit about it, seeing some patients with him, attending the course, and it's kind of been an excellent journey since then.
And it's great to have the peer support as well. We've had a few colleagues come from Leicester, and we have some great chats about our patients. And it's kind of been an evolving process, I think, is trying to get this into practice is very difficult. There are time constraints when you're seeing 15, 16 patients within your clinic. To be able to spend the time with these people is very demanding. But to have that kind of peer support network is really important, I think.
So just in terms of how you would encourage other people to take this on, have you got thoughts on that? Because, you know, one of the things that we get concerned about is we worry that people get bogged down into the detail and don't see the big picture, which is why this workshop's deliberately tried to be more big picture. So we don't want you to get stuck on, oh, is it this pattern or that pattern or whatever, because that's not what worries me. I wonder what your thoughts are on that.
I think from my own perspective, I looked at back pain, and I would say personally I had a lot of fear with regards to treating people with complex lower back pain. What I found with this approach is that it simplifies something that's really, really complex, and Peter's touched a lot on it over the last couple of days about a lot of the tests that we use that lack validity and a lot of the issues around certain sticky beliefs. What I would say is that you're going to need to obviously put the work in terms of reading, taking videos of patients, comparing sort of cases with your colleagues and that sort of stuff. And obviously I've been on this course, this is the third time I've been now, and I'm picking up something new each time. But yeah, it's definitely instills confidence both in yourself and obviously in the patients as well.
So why? What is it that instills confidence?
I think in terms of with regards to this case group, we see that because naturally, I suppose our training dictates that the spine is an area to fear. Okay. It's probably a case of once I realised that actually I don't need to worry about treating these people, it's like treating any other part of the body, I suppose that kind of reduced my fear significantly, and then that transpires towards the patients. I think the key thing from my own perspective is the actual looking at a patient and realising that they're unique and they've got a unique set of factors that drive their pain, and getting that history, that listening to their story is so important.
Yeah, I think be brave. Go speak to your patients, let them talk to you. Okay, give them time in the first session. You were mentioning yesterday how, you know, we feel like we have to deliver an intervention. I think people are far more satisfied when you sat and listened to them for 45 minutes about their story. You understand their context, and then you're able to kind of outline the factors that are driving it. So, you know, it is about being empathetic, but also one of the things that I think I've found hard is to be really tough on the maladaptive behaviours, particularly the movements, to try and shift them out of the person. So time is one of the big things, communication, and not to buy into their story.
So the question was, how have you dealt with the management in doing that? You've obviously had good support.
Yeah, we're very fortunate. We've got a great team behind us and great management who have enabled us to be able to do this with our patients. I think collecting the data like this is gold. I think it's really important that we enable to go back to our service providers and our commissioners. I think that this kind of data shows that what we're doing is kind of significantly different to what's gone before it. And I think that's where we have to go into trying to influence the service.
I'm just interested in what you consider are the barriers for your colleagues taking up this approach. I'm interested in that because we work really hard to try and I'm constantly trying to work out ways to the most simple way of disseminating information. And we talked about this website that we're putting up where we're going to place these videos up. It won't just be for the public, so no one's exposed to it, but to trying to shift that belief, I suppose, that there is hope for these people. But I wonder what you perceive are the main barriers for you.
That's a really important question. We talk about changing patients' beliefs. You know, we've got to change massively as well. And I think some people adapt to this very, very quickly, and some people it's very difficult.
I think the main thing really from what our colleagues have discussed about applying this approach in clinical practice is the time factor. And I think you need to be prepared to maybe run over a few minutes to begin with, and then I think it gradually
follow my advice.
will get easier. I think the other thing from our own perspective is a lot of people aren't comfortable with dealing with pain and the emotional aspect of it. And I think that's something that we both kind of definitely prepared ourselves for and have started to become a lot more comfortable with.
That's great, it's really great feedback. One of the things we've been reluctant to do is to promote this approach without having data. And I'll talk to you about data, I think it is here. James gives me a hard time about that. But it's very important. It's very important. I mean, the trial up in Bergen is the first trial that's been conducted testing this approach, and I'll talk you through some of that data, and it's been published in the European Pain Journal. And there is acknowledgement of the fact that we don't really know what the effects are. And you can read, hopefully you have read it, that paper, but you'll see in the limitations of the study, we don't know what the effects are. But what we are seeing is that the big shift for these patients when we followed them up, like a year later, is that they're saying that they have changed their beliefs, that they've been more confident, that they're not so fearful. And, I don't care what you do with your patients, really. I don't care what you do. If you achieve that, I bet you get a better result. Now, I'm not saying this is the only way, but I am saying that we're seeing this huge influence of negativity that is affecting the health system around pathologising pain, around reinforcing negative beliefs, around avoidance behaviours, and we need to have a change in narrative around how we do that. Now, I'm not saying this is the only way. It is not what I'm saying at all. But I think it is great that you've got these two guys who've gone out there and had the guts to test their own work and put it in. I think it's great to discuss that. But it is also very important that this approach is tested in other areas. And I'll show you some of the data this afternoon. Kieran O'Sullivan took people off a wait list for attending a pain clinic. And he followed these people for 3 months, and then he intervened with 3 months, and he's doing a 12-month follow-up. And these people have shown very similar effect sizes as well. Now, Kieran also was a guy who's very positive and motivated and is applying a lot of these principles. And these principles are principles that should be embedded in clinical practice. And they need to be tested, and they need to be tested against controlled trials. And there are now a number of studies that are looking at testing this approach against other approaches in a well-controlled environment, and that must happen. But I'm not saying that this is the way. I'm saying this looks to be better than a lot of other approaches that are currently out there. And at the end of the day, if I'm hearing that this approach builds confidence and it builds your belief and not fearing the back and changing your narrative and dealing with pain, then I've done a good job. That's how I feel. What the mechanism was exactly, I really don't know, and I don't think we do know. What we have, we just did a analysis of the Norwegian data to look at what the key predictors were for change, and it looked like the change in pain was the strongest predictor for the change in disability, which was interesting. It wasn't actually, it was the change in pain. And I think what this approach does give people is a means of managing their pain. And that can then build their confidence and build their ability to change. And it's good to be sceptical, it's good to be questioning, and it's, that's part of what's driven me down this process as well, of moving away from things that really haven't been so successful. And I've gone at them with great enthusiasm as well. And look, this is an emerging area. It's not like this is an end point. This is part of a journey, and the journey will continue. But if it results in, a building confidence and enthusiasm and a less fear in what you're dealing with, that's cool. I'm happy with that.